Thank you very much, Julian, for your kind words. There's a microphone now, but I'm told I can walk around, so I will be walking around. We first need to just think about what the words mean. So just for those of you who wonder what it's all about, so pharmacology is the branch of medicine concerned with the uses, effects and modes of action of drugs. So that's what I do. I do drugs. Therapeutics is the branch of medicine concerned with the treatment of disease and the actions of remedial agents. So that's not the recreational drugs, that's medicines. So we first need to understand how drugs work. So what we've got is a drug binds to a thing called the receptor. Now you've all got millions of receptors in your body. You're born with them, everybody's got them. And drugs bind to receptors to form what we cunningly call the drug receptor complex. And that drug receptor complex then produces your response. So that's straightforward lock and key hypothesis, as we call it. Rather than agonists, there's a group of drugs called antagonists. They do not fit the receptor correctly. So they go into the receptor, they form this drug receptor complex, but because the fit is not perfect, there's no response. The point about antagonists is they produce no response other than to block the effects of agonists. So your body is producing thousands of agonists every day to act on receptors, to make you think, to make you walk, everything. We can then give you drugs, antagonists, to block the effects of these drugs. So we can block the body's natural events. So that's one form of drug action. I'm going to be talking about some antagonists later on tonight. Another form of drug, similar, is a drug which acts on an enzyme. Now an enzyme is a biological protein. This is meant to represent a protein. And what it does is it changes other chemicals. It doesn't itself change. So a thing called a substrate interacts with an enzyme, and then you get an enzyme which is unchanged plus products. So you've all got enzymes and they're all working. I know they are because you're living and breathing at the moment. Some drugs are enzyme inhibitors. So we've got a little representation of a drug molecule up there. So some drugs are enzyme inhibitors. And what they do is they block this enzyme from functioning. So there's the substrate, there's the enzyme. You'd expect substrate plus product, but because of the presence of this little drug here, the enzyme doesn't work. So we've got an enzyme blocker, an enzyme inhibitor. And I'll be talking about enzyme inhibitors tonight as well. So, 1961, 1st of April, was actually my 3rd birthday. And there's me, 1961. And in 1961, there was a paper published in Pharmacological Reviews about angiotensin. Now, angiotensin had been known about since the start of the last century, but it had been rather ignored. And in 1961, this is about the earliest approach to what does it do. So what does angiotensin do? I need to take you through this a little bit slowly. So angiotensin 2 there is the thing that I'm most interested in. And angiotensin 2, it acts on your heart to make your heart grow. It acts on your blood vessels to make them constrict. You get increased blood volume because it makes you thirsty. It acts on the kidneys to cause sodium retention, on the pituitary gland to cause, again, thirst, antidiuretic hormone, and on the adrenal cortex to produce a substance called aldosterone. You don't have to worry about that, but basically angiotensin 2 does everything it can to raise your blood pressure. It's converted from a thing called angiotensin 1, And this is where you'll see that pharmacologists are really, really inventive with their names. So angiotensin 1 goes to angiotensin 2. And the enzyme that does that is the amazingly named angiotensin converting enzyme. So angiotensin converting enzyme converts Ang1 to Ang2. You've all got angiotensin floating around in your blood, and when you change position, change posture, your kidneys release an enzyme which converts angiotensinogen to Ang1, Ang2, raise your blood pressure. Long story, when you get out of bed in the morning and you change from a lying position to a standing position, your blood concentrations of angiotensin 2 rise tenfold in the time it takes you to stand up. And that's what stops you falling over every morning. Okay? So Ang2, really, really quick and really, really important. This is 1969, and this is a publication in British Medical Journal. You're not meant to be reading it, but basically it's saying, we think that angiotensin 2 is important in high blood pressure. 1969 was the first hint. So what's going on? And people started to think, if we play with angiotensin 2, can we treat high blood pressure? So here's my snake, Bothrops jararaca, and the snake that you've seen in the posters. If you get envenomated by Bothrops jararaca, your blood pressure collapses and you die of cardiovascular collapse because your blood pressure falls. It was reasoned it's something to do with the venom, that's not difficult, and people looked at the venom from Bothrops and extracted a chemical from which they developed a range of drugs. That was early 1980s, late 1970s, and those drugs are angiotensin converting enzyme inhibitors. So the snake venom contains angiotensin converting enzyme inhibitors, which lowers your blood pressure. So if we use these ACE inhibitors, we can stop angiotensin raising your blood pressure. About 20 years after the ACE inhibitors were released, a drug company then produced a group of drugs called the angiotensin receptor antagonists. So instead of blocking synthesis of angiotensin, they block the action. So these are the antagonists, and this is the enzyme inhibitor. Effectively, they're both doing the same thing. They're stopping the actions of angiotensin, lowering your blood pressure. ACE inhibitors and angiotensin receptor antagonists are now the first line treatment for high blood pressure in the UK, in Europe, in North America. The drugs are so well used, they're safe, well known, very, very effective. My view of the renin-angiotensin system is slightly more complicated, and I'm not going to try and take you through all of this. But what I've told you is that angiotensinogen is converted to Ang1 by renin. ACE then converts Ang1 to Ang2. Ang2 acts on the AT1 receptors to raise blood pressure. What we also know, however, is this Ang2 can be broken down to another compound. Look what it's called. Angiotensin 3, can't beat it. And then we go to Ang4. Okay? And then we've got this little breakdown product. And this Ang4 acts on its own receptor, insulin-regulated aminopeptidase, we'll call it IRAP. Ang4 acts on IRAP and is involved with learning and memory. So if we play around with angiotensin 1 to control our blood pressure, we're going to have effects on Ang4, which may alter learning and memory. So in 1999, I was based in Cockcroft Building. If you can see that, it's difficult for me to see where I'm standing. So this is Cockcroft Building. Huxley Building is now being built in this space here, and my office was just about there. So I was based in Cockcroft Building, and we, in collaboration with some colleagues from Poland, we did some work on some animals with a substance called, a technique called novel object recognition. So what's novel object recognition? We put a rat or a mouse into an environment, a cage, with two identical familiar objects. When I was taught this by Polish colleagues, we used to use 2 university mugs. We're now, this is the 21st century, I now use Lego. We've gone that far. So we used to put the animals into a cage with 2 mugs, take them out, put them into the home cage, then put them back into the cage an hour later with the same 2 mugs. And then the next day, put them into a cage with 1 mug and 1 cup. Okay? And the idea is that they think, that mug I've seen before, I've never seen the cup before, and so we record how long they spend exploring the cup. And that's a measure of learning and memory. So what we can see here, there's a mouse there, and the mouse, this is the familiar object, and that's the novel object, and this is a track of the mouse walking around the cage. And what I hope you can see is that it spent longer exploring the red, you can't see it's red, the Lego cross than the yellow and blue Lego square. And that's the novel object. So what some of you probably don't realise is, as there are different breeds of cats and dogs, there are also different breeds of rats. Long Evans, Wistar-Kyoto, Lewis, they have different characteristics. So this is novel object recognition, and so what we've got here is the height of the bar represents how well they have learned. So Long Evans learnt quite well, the Wistar-Kyoto didn't learn very well, the BB, which are diabetic rats, didn't learn very well, and Lewis rats are really quite stupid. So we have a group of stupid rats. If we look at their brain content of angiotensin receptors, these are the receptors on which angiotensin works. The Long Evan rats have got lots of angiotensin receptors. The Wistar-Kyoto have got less. They're not bad. The BB have got fewer, and the least of all of the Lewis rats. So the thicker the rat, the less angiotensin receptors. So in 2002, I wrote a review for the European Journal of Pharmacology, when this is where it really all took off. And what we were saying is that angiotensin 2 there improves learning and memory, but also ACE inhibitors, which prevent the synthesis of angiotensin 2, improve learning and memory. What on earth's going on? How can you block angiotensin synthesis and improve learning and memory, and also give Ang2 and improve learning and memory? And what we realised is it's angiotensin 4. Angiotensin 4, the byproduct, is the important thing. So this is giving some animals, some mice, angiotensin 4. So these mice have received Ang4. This is the amount of time they spend exploring the familiar object. This is the amount of time they spend exploring the novel object they've learnt. These mice have received an injection of salt water, saline. They don't learn. This little bar up here just says it's statistically significant, and these error bars, these show you the scatter of data around the mean. But importantly, Ang4 improves learning and memory. So it's generally believed that the previously observed effects of Ang2 and ACE inhibitors are mediated by Ang4, but we don't actually know the real mechanism of action. Why change a winning technique? So we've had different strains of rats, now we go to different strains of mice. So these are 4 different strains of mice, CD, C57, the BL stands for black, that's clever, BKW and DBA2. And a very noisy slide. What you can see here is, if I go to this one, CD mice, they're not too bright at learning, and as we increase the dose, so the red bar here is low dose Ang4, the yellow bar is higher dose, and the green bar is even higher dose, we get this weird dose response curve. CD didn't learn. C57 mice, they learn quite well on their own with just salt water, but Ang4 really works well in low dose. In high dose, it all falls over. BKW mice, they learn well at low dose, but at high dose it falls over. DBA2 mice, again, they're really stupid. They're animals that don't learn very well at all. Give them any dose of Ang4 at all, and they learn. So there's a dose-related effect. So we decided to go into humans, and this is the School of Pharmacy at Brighton. This is the staff. They're a tremendously motley group of humans. And we decided we were going to go into hypertensive humans. So we can't give Ang4 to humans, like staff, but we can give existing drugs that alter Ang4 function. So we went to Poland, and we got some hypertensive patients from Poland, and we went to the Medical University of Białystok. And again, a noisy slide, but it's there for a purpose. These are your control patients. This is their blood pressure, 123/79, healthy control patients. These are our hypertensive patients, 150/96, so they've got high blood pressure. And these are patients that will be receiving captopril, which is an ACE inhibitor, or enalapril, which is another ACE inhibitor. Notice that their blood pressure has come back down. So they're treated with antihypertensives. So this is a Wesley auditory verbal learning test, where you're given 15 words and you have to recall how many words you can remember over different time points. So it's after about 5 minutes, after 20 minutes, and so on. These are the controls. The blue bar there is the controls, and they can remember quite well. These are the hypertensive patients. Their learning is impaired. High blood pressure, hypertensive patients, impaired recall of words. This is the captopril group, slightly better, but the enalapril group are significantly different from the hypertensive group. So enalapril has not only treated the blood pressure, but their learning and memories come back. If we come to this slide here, exactly the same pattern. This is a different scale, Wechsler memory scale. Control patients, they're good. Hypertensive patients are impaired. When we give them captopril or enalapril, they come back up to there. We're treating the hypertension and they're getting better. So then we thought, how about healthy students? Now those are University of Brighton students. We would never use University of Brighton students in a drug trial because they're far too precious to us. So we used University of Sussex students because we don't care. Take healthy undergraduate students, and these are University of Sussex students, they're not stupid. So give them placebo, and this is a detection rate and a prospective memory task. Prospective memory is remembering to do something when another event occurs. So it's a case of, when I go to the shops, I must remember to post that letter. So it's 2 stages on. Prospective memory. We gave them low-dose losartan, and these are healthy young 18-year-olds, low-dose losartan, and we managed to improve their prospective memory. High dose, it's good, but it's not significantly improved. Remember the mice? That had a weird dose-response curve as well. In these students, we had the same effect. We did 2 other tests. This is, if I can read it, this is reaction time. So the lower the bar, the faster they are. So placebo, losartan, no difference on reaction time. We gave them scopolamine. Now scopolamine, for all you Bond movie lovers, is truth drug. So we gave them truth drug. It's actually a sedative, it slows them down. So we slowed them down, and then we gave them losartan as well, and we speeded them back up again. So effectively, losartan can improve performance in an impaired, healthy 18-year-old. That makes sense. Exactly the same here. This is exactly the same, isn't it? That's the reaction time. No, this is the cost of carrying an intention. It's a slightly different test. Same results. We can impair them with scopolamine, but we can improve them by giving losartan. So if we've got healthy 18-year-olds, we can give them losartan and we can improve their performance. Then we went to Saudi. So we go out to Saudi and we think chronic kidney disease patients, they're an interesting group of patients. So what we have here is, should be the letter cancellation there. Read a body of text and cancel every letter E as it goes through. So it's a measure of attention. There's your healthy volunteers, no kidney disease. These two bars, the red and the yellow, have got chronic kidney disease. They have got significantly impaired letter cancellation skills. Having kidney disease causes impaired cognition. If we treat you with a renin-angiotensin system drug, an ACE inhibitor or an angiotensin receptor antagonist, your impairment is less than if you're treated with other drugs to treat your kidney failure. There's a choice of drugs. If we give you the renin-angiotensin drugs, your impairment is less. If we give you the other drugs, calcium channel blockers, for those who are interested, they're still impaired. This is quality of life. How do you feel? Healthy. The kidney patients don't feel too good. But look, the renin-angiotensin group, they're not as bad as the group receiving calcium channel blockers. So if you are a kidney patient, depending on which drugs you are given, there will be a difference in your intellectual performance. This is mental fluency and exactly the same picture, but here the renin-angiotensin groups are not significantly different from the healthy group. The other group of the patients receiving the other form of treatment are significantly impaired. I'd spent so long working with the Saudis, I took Arabic lessons, and I spent 6 years learning Arabic, and this is the height of my career. So this is Hal al-Quradik Sa Yathab ila al-Matayam Mainar, and apart from the school office, there's a prize for the first person who comes up to me after the lecture and tells me what it says, okay? But how does angiotensin 4 produce its effect? We've shown it works, we've shown that drugs work. How does it produce its effects? So there was a paper published in 2002, not by me, by a group of Australians, and they said angiotensin 2 produces its effects by two possible ways. One is to inhibit an enzyme, and we know about enzyme inhibitors, and the other way is to enhance glucose uptake into cells to give your cells more food so that they can actually be more active. So I was lucky enough to go to Brussels, where we looked to see whether angiotensin 4 inhibits an enzyme that breaks down a product called oxytocin. Now, half the audience are female, half the audience, you've got lots and lots of oxytocin. It's really important for breastfeeding and uterine contraction. Males have also got oxytocin, but it's not quite so important. But oxytocin has been shown to be important in learning and memory, especially in young mothers with new babies. So IRAP, insulin regulation of monopeptidase, normally breaks down oxytocin. If we give Ang4, IRAP doesn't break down oxytocin. So that's really quite important, but more importantly, this is me in Brussels. Brussels is the home of the EU. This is a radiochemistry laboratory. I am not wearing gloves, lab coat, or safety specs. I queried it, and they said, we don't believe in EU regulations in Brussels, just don't worry about it. What we've got here is, this is novel object recognition, and we're looking, the higher the bar, the longer the difference between familiar object and novel object. So saline is the control treatment. Oxytocin improves learning in mice. This was the first time it's ever been shown, so I managed something there. Oxytocin improves learning in mice. Angiotensin 4, the control's a bit weird, but Ang4 improves learning in mice. A drug called physostigmine, which is used to treat dementia, improves learning in mice. And this oxytocin antagonist, it blocks oxytocin, showed a slight effect. I could explain that perhaps, but we haven't got time. More importantly, oxytocin antagonist blocks the effects of oxytocin. That's good. So oxytocin improves learning and memory. Oxytocin antagonist blocks that. The oxytocin antagonist blocks the effects of Ang4. Yeah. And the oxytocin antagonist actually blocked the effects of physostigmine. So it appears that oxytocin may be really important in learning and memory, and that Ang4 prevents the breakdown of oxytocin. So what about other animal models or conditions? So this is a road sign that I saw in Jordan, and I just thought that's a real choice. Okay? Really interesting opportunities and really interesting risks. Which way do you go? So I thought to myself, I could carry on looking at Alzheimer's disease, competing with Pfizer, AstraZeneca, every other big drug company in the world, or I could change tack and try and get a novel approach to life. And I decided to look at other things. So we went back to Sussex, and they do an experiment called early life stress. And in early life stress in humans has been shown to cause a significant increase in the risk of developing mental illness. So just depending on your very early experiences, you can have effects on your adult life. So at Sussex, they take newborn mice, and for the first 9 days of life, they remove the bedding. And after the first 9 days of life, they put the bedding back and let the animals grow normally, and then we assess novel object recognition. So they remove the bedding for the first 9 days of life. This is your early life stress. Novel object recognition, the higher the bar, the better they've recognised the novel object. Significant difference there. Early life stress causes impaired learning in 2-month-old animals that have been deprived of bedding in the first 9 days of life. There's exactly the same graph there, but when we give them angiotensin 4, the exciting thing is Ang4 improves learning and memory in the control group. But look at this. The Ang4 in your early life stress group has brought them back up to normal. So Ang4 appears to improve learning and memory in 2-month-old adolescent animals that were deprived in early childhood. So this is Huxley, and now I can say, and that's my office there, although it's only temporary, decided why not look at fetal alcohol syndrome. So fetal alcohol syndrome, approximately 1% of babies born in Europe adversely affected by the fact that their mothers have drunk alcohol during pregnancy, and it causes intellectual impairment. So we gave harems of mice either 5% alcohol, which is beer, or straightforward saccharin, which is alcohol-free beer. And they had a 2-bottle choice, and they could either drink water or they could drink beer or alcohol-free beer. And then once they were weaned, we switched them on to normal water, it's just straightforward water, and 2 months of age, we test novel object recognition. And here we are. This is normal mice you've seen before. So Ang4 improves learning and memory. When we come to the saccharin group, this is the alcohol-free beer during pregnancy. Ang4 improves learning and memory. When we come to the alcohol group, Ang4 doesn't improve learning and memory. We've got a learning deficit in mice whose mothers were exposed to alcohol during pregnancy. So what's going on? Well, what we've got is angiotensin 4 acts on IRAP, is what I've said. It inhibits IRAP to improve learning and memory. But angiotensin 4 and Ang2 act on the AT1 receptor to raise blood pressure. I've told you that. It also increases anxiety. So maybe we've got increased anxiety. This is saccharine animals, distance moved, and all we're showing there is that the alcohol and the saccharin has no effect on distance moved. There's no impairment. So why is the alcohol without effect in the alcohol animals? This is a thing called elevated plasmase. It's a simple cross of wood, and there it is. Put two of the arms have got walls, two haven't. Put a mouse in there. They're frightened of the open arm, and they're comfortable in the closed arm. If you give a mouse a drug to decrease anxiety, they get really brave and they come and dance on the open arms. Normally they hide in the closed arms. So, what about snake venom? What happens there? So what we've got Ang4 here. Ang4 decreases the amount of time spent on the open arms in control animals and a little bit in the alcohol group. So Ang4 seems to improve learning, seems to increase anxiety. The lower the bar, the less time on the open arms. So we've increased anxiety. This is the novel object recognition where we gave them captopril. So control males were given captopril, and this is in the male alcohol. And what you can see there is that captopril increases the time spent on the novel object recognition. Captopril alone appears to improve the amount of time spent exploring the novel object. It improves learning and memory in control males. In the alcohol group, it doesn't work. I'm trying. I can't get my alcohol group to work. So, this was me, age 9. This is me now. Things have moved on. I've learnt to use better equipment and I can do more exciting things. So I thought, tell you what, let's go back to principles. Instead of blocking the anxiety with an angiotensin converting enzyme inhibitor, let's use losartan. So this is the time spent exploring open arms. This is your salt water group, saline. This is the Ang4 group. You've gone slightly down. When you give Ang4 plus losartan, they're really brave. So losartan decreases anxiety in the MA male alcohol group. These are mice who've been exposed to alcohol. Tried different doses. 1 milligram per kilogram of losartan causes a slight effect. 10 mg per kg of losartan in the control group there, familiar and novel. Got learning and memory in our control group. Losartan improves learning and memory in our control group. What about our alcohol group? This is the big result of the month. This is losartan improves learning and memory in adolescent animals whose mothers have been exposed to alcohol during pregnancy. We have just reversed learning deficits in fetal alcohol syndrome. So future drug developments, could losartan improve learning and memory in fetal alcohol syndrome? That's the clinical trial, which would be really nice to do. Obviously we need a bit more data. Remember my choice? I could have gone left or right at the crossroads. I decided to go down the fetal alcohol group. Some colleagues of mine said we'll stick with the Alzheimer's group. And I'm fortunately involved with this. This is a big MRC, Medical Research Council, clinical trial in Bristol, reducing pathology in Alzheimer's disease through angiotensin targeting. What I showed many years ago in animals is now being tested in humans in Bristol. Okay? We've actually gone from bench to bedside. This is a big clinical trial. Obviously, I didn't do this on my own. This is a thing called a Wordle, and the bigger the letters, the more those people have contributed to my CV. So Jeff Hanlon's here tonight. I've had an email from Sergey, who I think he left for Kazakhstan yesterday or something, I don't know. Andrew's in here tonight, Andrew Lloyd, and Mandy's in here tonight, and Jackson. Yeoman's up there at the top somewhere. Okay, so all of those people, there's a little Chatterjee sitting on the corner. Even got a macadam look. Okay, so all of these people have contributed to what I've been doing. But it doesn't really stop there. She spent hours being bored out of her brain by angiotensin. And my mum's still around. She's not here tonight. She's getting a bit old, but she's still around. Mum of the, when are you going to be a professor? She's been asking me for the last 20 years. So we got there, and she knows about it. So they were really important in what I did. And that's what it's all about. So hopefully you can see we got the snake venom, we got the alcohol, and the brain ACE, not as Mandy said, suggests that I'm an ACE in the brain. No, it's brain angiotensin converting enzyme is the subject of the lecture. Thank you very much.